Hello, everybody. So, today we are discussing nothing else but the physiological processes that are physiological changes that occur in a pregnant female. So, let me start over with the hormonal changes at first. So, the hormone that is produced that is, firstly we'll discuss about progesterone. So progesterone is produced by the corpus luteum, which is indeed till the 35th day of conception, and afterwards what happens is that this progesterone produced by the corpus luteum's role is handed over to the placenta. That is, placenta after the 35th day of conception starts to produce the progesterone. So the changes that is observed as a result is increase in the body temperature of the pregnant lady. The muscle excitability decreases in the uterus, in the gut, in the urethra. Okay, and not only that, we know that the thyroid gland increases in size and during the pregnancy, often enlarges because of the increase in the colloid. Okay, and we also know that the maternal cortisol output is also seen to be increased. Now, genital changes that occur, the first and foremost thing that I have to tell you is that non-pregnant females uterus is weighs around 100 grams, whereas a pregnant female's uterus weighs around 1100 grams. Okay, so cervix may develop even erosions or ectropyons, and we have also observed the cases that we have also observed that in the pregnant females, the vaginal discharge increases due to cervical atrophy, and mucus production increases from the vastly congested vagina. Okay, now hemodynamical changes that occur in a pregnant lady. What happens is that in a non-pregnant lady, the amount of blood from in a pregnant lady, amount of blood from the 10th week plasma rises until the 32nd week of conception, uh, when it is around 3.8 liters. And what we have also observed is that RBC increases from 1.5 to 1.64 liters in a pregnant female. And it's not only that, by the term, okay, at term it increases up to 1.64. We have, as per what we have, I have come across, I have seen that iron supplements that is required in a pregnant female as per the US guidelines is 1000 mg per day. But for sure, we are not consuming, or most of us are not consuming, 1000 milligrams of iron in our daily diet. But so as a result of that, what we have to do is we have to take iron supplements. In the case of pregnant females, it's very much required to take iron supplements, as India is one among the leading countries with iron deficiency seen in pregnant females. That is, most of them are seen to be anemic. That is, around 1 in 5 is seen to be anemic. So it's very much required to take the iron supplements, and we do require to take the HB amount during pregnancy. All right. So not only that, we can also see that the cholesterol and globulin and fibrinogen, all of this is said to be increasing, whereas albumin and alpha globulin is seen to be decreasing. Okay, so the cardiovascular changes that is seen in pregnancy is that cardiac output increases from 5 liters to 6.5 to 7 liters in the first 10 weeks, and increase of stroke volume is approximately 10%. Peripheral resistance decreases, hormonal resistance due to hormonal resistance. Not only that, we could also see that the blood pressure in a pregnant female is seen to be decreasing to around 10 mm per 10 mm to 20 mm per mercury, but which regains to non-pregnant state blood pressure soon after reaching the term. Okay, as the person reaches the term level, it the diastolic rate, which we have seen to be decreasing, increases back to the amount a person has in their non-pregnant levels. All right, so varicose vein is seen. Why do we see that? It is formed due to increased venous uh, dispense dispensability, all right, and rise to venous pressure. So actually, we can also see that there is aortic compression. Why is it? After 20 week, the gravida uterus compresses the inferior vena cava. Not only inferior vena cava, we could also see that the amount of uh, iota is also getting compressed. So the solution for that is that we should lay the person to the left lateral position or tilt them in the supine woman. We have to tilt them to 15 degrees to the left so that they are relieved by the compression, and their breathing rate comes back to normal. Okay, that is cardiac output comes back to normal. Okay, the other changes that we have also seen is that the ventilation increases to about 40 percentage. Depth of breath increases due to the progesterone effect. All right, all of this is seen, and it's also seen that the gut motility decreases, which results in constipation, heartburn, and the sphincter. The sphincter, gastroesophageal sphincter, which is present in the humans. In pregnant ladies, what happens is that it it doesn't close most of the time, or there is a difficulty in the closing of uh, gastroesophageal sphincter. Thus, as a result of this, what has observed is that the regurgitation is seen, and regurgitation is not only regurgitation is seen, it's also seen that the person will definitely have heartburn as a result of that. All right, it's also seen that the renal size increases by approximately 1 centimeter in length during pregnancy. Micturition increases, the frequency of micturition increases, bladder pressure, because bladder pressure is generated, or bladder pressure increases as a result of compression by the fetus head. Okay, fetus head compresses the bladder, and as a result of that, we can see the frequent maturation emerges. And let me discuss to you the different physiological changes that occur in the human body. Let me show you that with the help of diagrams so that it becomes very easy to understand. All right, the physiological changes during pregnancy includes linea nigra, that is a line. We could see that the line, see this line darkens off, yeah, darkens off during pregnancy, especially seen in pregnant ladies, is that the pigmentation increases. So as a result of this, the darkening increases, the stretch marks in pregnant ladies increases, that is known as stria gravidarum. And palmar erythema is seen. We all know what palmar erythema is. And a spider, a spider navy is seen. Spider navy, we can see this all throughout the body. And it's the nipple changes that occur during pregnancy, or the breast changes that occur during pregnancy, is that sore breasts are seen, dark and larger nipples, growing breasts, leaking colostrum, and discharge. This all changes are the physiological changes that is observed in a pregnant lady, and hope you guys understood it in details. Hope to see you guys soon in the next coming videos. Thank you so